Welcome to today's webinar. We're going to be talking about support group efficacy for perinatal mental health. My name is Mia Edidin. I am the director at Perinatal Support Washington, and I'm a licensed clinical social worker. I've also been running perinatal mental health groups for about 10 years. I'm going to tell you a little bit about a project that we are starting, and then also talk a little bit about Perinatal Support Washington's postpartum or perinatal support group program, and I'll tell you a little bit more about that. And I'm going to tell you about some outcomes from some of our support groups that we've been running over the years, and then a little bit about the model that we've been using. Hopefully by the end of today's webinar, you'll have a good sense of what the model that we use looks like, why it works, how it works, as well as information about outcomes, and then information about our support group program. So let's get started. Oops, my computer just has a little lag, so hang in there with me while I get the slides to move forward. So this is a pilot project that we're calling the Perinatal Mental Health Initiative. It's a project that's funded by the Department of Children, Youth, and Family, part of the Strengthening Families Washington Division. And it's a community-based perinatal mental health capacity building program. I'm going to tell you a little bit more about what that means. But the community-based is the important part, that we're really hoping to be working in communities to help communities address the needs that they're seeing for the families in their communities with some guidance and support from Perinatal Support Washington. So the project is prevention services. So it's child abuse and neglect prevention, CBCAP funding, from federal child abuse and neglect prevention funding. The goal is to support community-based efforts to develop, operate, expand, and enhance initiatives, programs, and activities to prevent child abuse and neglect with an emphasis on strengthening families. So the Perinatal Mental Health Initiative, we created this slide to sort of help give you an overview of the whole project. So there's a statewide component in which we are hoping to provide training to providers across the state. And we're doing that in two ways. We're doing two-day perinatal mental health trainings. We just did one in Seattle in February. We have a second one that's scheduled in Spokane in April. I'll give you the link to that towards the end of this webinar so that you have the information, that are free of charge. They're funded by the Department of Children, Youth, and Families. And then we're also offering quarterly webinars. This is the second of 4 webinars that we will offer. We did one in fall that was really looking at perinatal mental health from a public health perspective. Why is it a concern? What are the reasons why we would address this on a community level, and why, from a public health perspective. And then this webinar today, which is really looking at perinatal mental health support group efficacy. There'll be 2 more that are coming, and those dates and those topics are to be determined, so stay tuned for more about that. And then part of this project is also to do what we're calling a deeper dive in 7 communities. So we had an open RFP earlier this fall in which communities were able to apply for more sort of focused perinatal mental health capacity building support. And part of that project is in those 7 communities to create what we're calling perinatal mental health task forces, which are really like sort of multi-sector stakeholder meetings of diverse providers in the community to come together and start to think through what are the barriers to care that the families that they're serving are, where are the gaps in services, and thinking through how we can collaborate and come together and create a stronger safety net for families. Those 7 communities are also receiving a 1-day perinatal mental health training. They're also receiving training in support group facilitator, so the facilitator training, how to run a support group, but also training and support around starting a support group, and I will tell you more about that. And then also each community is getting support around creating a perinatal mental health resource and referral guide that's specific to their community. The intention of that is that a provider or a parent could pick up the resource and referral guide and know where and how to access the resources in their community. So from this work, we're hoping some of the goals are increased community capacity. So that's the support groups that each of those communities will be starting. It's also the providers that have more training in perinatal mental health, along with that resource and referral guide, to help create easy pathways for family. And then at the bottom of that triangle, the intensive high quality supports, we recognize that some families may need higher level mental health supports. If you're noticing, there's not a sort of a specific mental health training component to this project. And there's a lot of work to be done around perinatal mental health. And this project is really trying to help communities create a foundation in which to keep working to increase perinatal mental health services. And that really starts with sort of basic provider level training so that all the providers in a community understand perinatal mental health and why it's important. Having some easily accessed resources, so that's the support group, that's the resource and referral guide, so that we're starting to build a foundation in which we can continue to build, which would include more mental health services and more mental health supports. And that this is sort of the first year of this project, and there's other services that families might need, and this is just the start of the work. So these are the 7 communities that we're doing that focused work in. So we'll be working in Clallam, we'll be working in Cowlitz, in Pierce, in Skagit, Nahomish, Whatcom, and Yakima. If you notice, there's not a lot of communities on the eastern part of the state. This is a pilot project, and it is possible that we will do it again in the future. And we would really look to work with more communities on the east side of the state and reach out to them. One of the efforts to do that is the 2-day training that we'll be hosting in April, which will be in Spokane. And then also we'll be hosting a support group training in Yakima. I will tell you about it at the end and give you the link for it, that will be open to providers who are not in these 7 funded communities. So hopefully pulling from the east part of the state to increase resources. So the goals: increase capacity within communities to recognize, support, and or refer families to appropriate supports for perinatal mood and anxiety disorders among individuals and organizations that interact with families across contexts in the community. So we're really hoping that the folks that are coming to table for the task force meetings, as well as for the community 1-day trainings, are from a wide variety of just organizations or programs that are interacting with parents. They don't just have to be providers, because parents come into contact with a lot of different people throughout their first year. So including churches, childcare, businesses, healthcare, that we're hoping to expand universal knowledge around perinatal mental health. And then also to establish and maintain easy pathways for families to be screened for perinatal mood disorders and receive care as needed. And I'll tell you a little bit more about that. So just a little bit about Perinatal Support Washington. You all might know about us, hopefully. So I'm hoping that you all know this, and if not, then good information for you all to have. So our services are all statewide. So we are a statewide nonprofit, and we try and do work that addresses the need of, as many families as possible, and are accessible as possible. And so one of the services that does this is our warm line. So our warm line is available to anyone in the state. It's a call-in line. You can call at any time throughout the day. You leave a message and we call back. And we try and call back the same day as soon as possible. Sometimes it's the next day, especially if they call late at night. And the warm line is staffed by both peers. So those are parents who have recovered from a perinatal mood and anxiety disorder. We have both moms and dads on the line, or it's staffed by therapists who have training in perinatal mental health. And the warm line is there to provide support, information, education, and then also referrals. We have a very strong belief that how you give a referral and what referral you give is really important. in impacting whether or not a parent actually accesses the referrals that you're giving them. And so we really talk a lot with the families that call the warm line about what would be helpful for them, what are their needs in terms of looking at transportation, definitely asking about insurance and finances, and we always are trying to refer to someone who has an open practice, who's accepting new clients. And so again, our focus is on helping that person to access that next level of care, not just giving a referral. The other thing that we do when someone calls the warm line is we complete what we call a postpartum wellness plan. And that's really thinking about all the things that families can be doing to take care of themselves, in addition to perhaps calling their doctor or calling the therapist referral that we've given them. And those are things like, can we get more sleep? Can we eat, high nutritional foods? When you're stuck, perhaps taking care of a kiddo, it's hard sometimes to meet some of your basic needs. And yet we know that things like eating well, sleeping well, connecting with your natural support system, perhaps attending a new parent support group in your community, that those things really do impact your mental health. And so we're reminding the parents of all the things that they can do, and also thinking along with them of the things that they know that have helped them in the past, and helping them think about how they can access those things in this new phase of their life when it's hard often to do the things that we used to do to take care of ourselves. And so at the end of the phone call, we'll send them an email often of a written postpartum wellness plan that kind of gives them something to do, in the next days or weeks as they're potentially trying to access those referrals that we've given them through our provider list, which I'll tell you a little bit more about in a second. The other program that we do is we support organizations and individuals around the state in starting new parent support groups. So PS Washington doesn't own and operate any support groups. We have what we call an affiliated support group program, which is where we support others in starting new parent support groups. This started because we heard from professionals, parents, and programs around the state that they really were interested in starting new parent support groups, but didn't have the internal expertise to start those groups. And so rather than sort of Perinatal Support Washington needing to do all the work that is, there is to do around perinatal mental health, we thought, well, wouldn't it be great if we could start a program where we supported local organizations to do that? And so we use, I'm going to tell you about it a little bit more in the next slides, we use a perinatal mental health support group model that was developed specifically for working with new parents. I myself is a master trainer in that group model, and PS Washington has a license to train people in that model. So we train people in how to run a new parent support group, and then we help them with kind of the logistics of how to start a new parent support group, because we've done it so many times. No one has to recreate the wheel. And then we provide ongoing support for those professionals and organizations if they have questions about a parent, if they need resources, if sometimes it's not a mental health professional that's leading the group, they can connect back with me and ask questions around, I think this mom might be struggling with, postpartum anxiety, but, I'm not a therapist, so I'd love to just chat with someone. So we can kind of provide them that clinical backup and support, which then helps programs to be able to provide services when they don't have that internal expertise. So those are our two direct service programs. The rest of our services are really about creating statewide resources and improving either provider education and information around treating mental health, or thinking about systems. So we have a statewide provider list. We have about, I think, around 275 providers on that list. It's comprised of therapists, medication prescribers. We also have doulas, lactation consultants on that list. Everyone on our list has training in perinatal mental health. So we know that when we're referring to someone, referring a family to someone on the list, that they're going to be getting good care. And we really cultivate that list and are always adding people. It's a really wonderful statewide resource. It can be accessed by parents by calling the warm line, or by professionals who are also welcome to call the warm line, or just email us if you're looking for a referral for a family in your community. We also do a lot of professional training and consultation. So we like to sort of say that we support and train everybody from the front desk staff all the way to the psychiatrist that might be supporting a family. We strongly believe that everyone who's working with, I guess we should just say people, not just new parents, need comfort and training in talking about emotional and mental health. And so it's important to not just be training the mental health provider, but be training everyone who's working with new families and how to talk about emotional and mental health during that period of time. And then the last thing that we do is, we really do think about how are the social policies and the systems in which we live as providers, but also our clients live within, how they're impacting them and how they're impacting their mental and emotional health during this perinatal period. And we think about ways to improve them, and we engage in that. And we think that that's really important, to not just be treating the individual, but to be thinking about what context that individual is living within, and are those systems or policies need to be changed in order to support them. So our affiliated support group program, I told you a little bit about it. It contains consultation on startup and logistics. We also provide the how do you actually run the support group training, so the facilitator training. We provide ongoing clinical support and consultation. We provide a community of facilitators. So all of the folks in our affiliated program have access to each other to ask questions, to say, how did you all do this? Sometimes it's, hey, I have low attendance this month. How has someone else helped get the attendance up? Or sometimes it's something like, I really need support. I had a really hard group, who's available? So I provide that, but also the other facilitators can provide that for each other. We also provide ongoing training on special topics. Examples of this is mindfulness is a large component of the group model, and so we'll do trainings on mindfulness for anxiety or depression, obviously taking into account that new parents' mindfulness might look different than for someone who has older kiddos. So that's an example. We've done training on medication during the perinatal period. We've done trainings on self-care for ourselves as facilitators, how to continue to do the work. So we do lots of training on special topics. And then we also help all of the support groups on program evaluation. So we have created both the tools and sort of the policies on how to evaluate support groups. And so we support them on that so that they can be gaining some information about how their support group is meeting the needs of the parents in their community, and then continue to refine and improve. So a few examples of groups. So, the groups that we work with are really diverse, not just in terms of the communities that they're serving, but in terms of the training and the credentials of the staff, the location that they're being held. And so these are just a couple of examples that I wanted to point out for you all. So there's been a group in Pierce County called Balance After Birth for Women of Color. It's currently held at the Lakewood WIC Clinic. It's facilitated by WIC and public health staff. They're two women that are both women of color, and they're trusted professionals in their community. It's a collaboration really between Perinatal Support Washington, who has supported the Lakewood WIC Clinic in running the group by providing some of the things that I've talked about already, the how to facilitate the group, so the facilitator training. I'm available to answer questions to them, but then also a partnership between WIC and public health. Neither of those staff are mental health providers. At least one of the facilitators identify as having had a postpartum mood disorder themselves when they had children. So that's one example of sort of who's running the group and where it's being run. There was another group that ran, it's no longer running, that was in Yakima. It was called Circulo de Madre. Sorry, I do not speak Spanish, so I don't have a nice accent. It was facilitated by a licensed clinical social worker who was a native Spanish speaker, but it was a collaboration. So it was hosted at a local community organization called La Casa Hogar, and it was the facilitator, who was a licensed clinical social worker, was staff at the Yakima Valley Farm Workers Center. So again, it was a collaboration of two community organizations that came together. They thought about where it would be a good place to host the group. And so they decided that La Casa Hogar was a good place to host it, but then the facilitator came from another organization. And that's an example where the facilitator was a mental health professional. The next group that I wanted to just point out to you, it's called This Is Not What I Expected. It's at Evergreen Hospital in Kirkland, Washington. It's facilitated, oops, sorry, there's a little bit of a typo there. It's facilitated by a recovered parent, so a peer, a parent who had postpartum mood complication actually a couple of times, so has, I think, 4 children now and has the experience of having had a postpartum mood disorder and then choosing to have another child and then having it again, and sort of has a lot of personal experience to draw from and to connect with the parents. She's also a childbirth educator and employed at the hospital. So this group is really considered to be peer run, and it's part of the hospital's parent education program, and they offer it free of charge, I think up to 3 or 6 months. When some of their other groups that they offer for parents does have a charge, this group doesn't. So again, it's not run by a licensed mental health professional, it's run by a parent. And it's a good example of how parents can really support other parents. And then the other group I just wanted to tell you a little bit about was called the Mother Circle. It was in Federal Way. It was located at a building that had co-located services. So it had a mental health like community mental health agency, it had public health, it even had primary care and dentist. It was sort of a one-stop shop for parents. It had WIC there. And it was facilitated by a therapist from the community mental health agency on site, and a lactation consultant and WIC staff from the WIC public health side. And the clients were pulled from sort of all of the programs that were serving families. So it was another interesting example of where you can locate the groups, who can run the groups, kind of ways to think about pulling families into the groups. One of the things that we have found in general is that the groups that are the most successful are groups that are embedded or located at places or organizations or programs that are already serving childbearing families. So something to think about if you're potentially thinking about starting a group or sort of wondering where would be a good place to start a group. We sort of say, like, go where the parents are. And if there is a trusted professional that's working with those parents, then that's another really great way of thinking about where and how to start a group. So I'm going to tell you a little bit about the group model that we use. It's called Group Peer Support, so GPS for short. It was started by Liz Friedman and Annette Saiton. They are wonderful, radical women in Massachusetts that used to, they started and founded a nonprofit called Mother Woman. They've both since left that organization and started their own organization called Group Peer Support, and they are working to bring this model not just to new parents, but to other communities in which like a group model might work. So think about like recovery communities, or parents with kiddos with a medical diagnosis or some sort of medical need, not just thinking about perinatal parents. A little bit about the model: a trauma-informed and community-based group model that promotes personal efficacy, self-esteem, and positive mental health through increased social support, education, and empowerment. I'm going to tell you a little bit more about the model. So this is just a funny quote. If parenthood came with a GPS, it would mostly just say recalculating. So obviously they've titled, or they've named their organization GPS. So this was sort of a funny quote, but I think that it's really true that a lot of us are coming into parenting, no matter what age our kiddos are currently, and we're really kind of figuring it out and constantly navigating it. And there's no sort of one right way to be a parent or one pathway that every parent needs to take. And so it's really about skill building in terms of learning about ourselves, our kiddos, what works for us, and building that confidence. And we're going to talk more about that. And that's normal, not knowing what to do or having to kind of figure out what to do as your kiddo changes or as life circumstance changes. It is part of it, and we're not supposed to just know all the time. We're supposed to be developing a skill to figure it out. And the GPS group model really allows for parents to figure it out for themselves rather than telling them what they're supposed to be doing to take care of themselves. So it's a trauma-informed group model. So trauma-informed care acknowledges the role that trauma plays in people's lives. When we think about working in diverse communities, and when we think about working with women in any community, We know that unfortunately women experience a lot of trauma. And if we're also thinking about working potentially in an immigrant or a refugee community, or working with women of color, we have to acknowledge that there is a lot of trauma that people have experienced, and that they're potentially walking into the group with a new baby having experienced all different kinds of trauma that we don't know about. And so a lot of you probably know about, trauma-informed practices, and I'll tell you just a little bit more in a moment, but it's really the perspective of, if you create a space in which you don't even need to ask if someone has experienced trauma, but you create a space in which, if they have experienced trauma, hopefully they will feel that this space is safe enough, or safer, in which they can share their story. Then you're accounting for them walking in the door possibly have experienced trauma. So we don't need to say, have you experienced trauma? Then I'll do this. We sort of just assume that a lot of the people that might be walking into our doors or into our group might have experienced trauma, and we're going to sort of build a framework or build a space that will be safe or safer for people than in other groups or other care that they've received before. So GPS groups are trauma-informed and sensitive. They're led by trusted facilitators who represent the community and the lived experience of the group members. So we really strongly believe that whenever possible, especially when you're serving groups that have historically been underserved, that it's best to have a facilitator who is from the community and has the lived experience of those group members. So, some common examples: if you're leading a Spanish-speaking group for immigrant or Spanish-speaking women, obviously the group leader needs to be Spanish-speaking and native Spanish-speaking, bicultural, bilingual. If you're leading a group for women of color, the facilitator really should be a person of color themselves. And that, we'll talk a little bit about this more, but that people need a place to talk about their experience. And if that experience is racism, if that experience is xenophobia, if that experience is, mistreatment, they need a place to talk about it. And if we're not creating spaces for parents to talk about their experiences, then what we're saying is that those are for them to deal with on their own, and there's no really place to talk about it. And so if you're bringing people together in a group, you have to allow them to talk about the experiences that they're having day in or day out. Otherwise, what's the purpose of bringing people in together to talk about their experiences, right? We're asking them to kind of share their personal story, but if we're only asking them to share a part of it, because we don't really understand or we can't understand, then we're really not supporting that whole person. And we'll talk a little bit more about that in a moment. So groups are located in accessible and trusted locations. So again, depending on the group that is trying to be served, it might not make sense to have the group be at a hospital. It might not make sense to have a group be at a mental health agency. And it's really different by each group. And the best way to know is to ask. Again, so if you are a person who's from that group or have the lived experience of that group, you might know where those places are that would be the best, the best place to hold that group. If you're not, then it's important that we're really engaging the people that we are trying to serve and asking, is this going to meet the needs? Again, with the ideal situation being that the person is from that group and has that lived experience. So I talked a little bit about this. The groups are responsive to the needs of the community. So, really thinking about, one of the things that we were talking about recently is one of the communities that we're working with has a large Spanish-speaking community that are largely farm workers. And so we were talking about starting a group in summer, which is the highest season, right? That's when this community makes their money for the year. And so we were really thinking about, when or where would it make sense to hold this group, knowing that this is the high season. And so that's one example of really thinking through who you're serving and thinking about where the group needs to be and when the group needs to be to meet the community's needs, which can be tricky as a provider, because we also have to meet our needs as a provider, and we also have to meet, our program's needs and, our whole organization's needs. And so as the provider, sometimes we can kind of get pulled in different directions, but we will always be most successful if we are responsive to the needs of the community that we're trying to serve. So I just talked a little bit about this. It needs to be responsive to the needs of the providers as well. That the providers themselves need support, education, and training from their programs, from their supervisors, from their administrators. They also need clinical support from an organization like PS Washington, or another person or organization that has that expertise. That we don't just sort of train a support group leader and say, okay, go, you're on your own, have fun. That providers need a lot of support. One of the things about the GPS groups is because it does have a structure and a model, it's replicable and adaptable. So for instance, again, if we're thinking about serving different communities, what we often do after facilitator training is kind of sit down and talk with the facilitator that was just trained about how is this going to work for your community, or what needs to be adapted in order to better meet their needs. What needs to be taken away? So while it's a group model that is replicable, it's not rigid, and it's very adaptable and has been used in a lot of different communities with all different families from different cultures, races, religions. And one of the things about the model is because it's not a curriculum, we're not trying to teach anybody anything. We're trying to create a space in which parents might feel comfortable sharing their experience. There are parts of it that are very adaptable and need to be adaptable to be culturally appropriate. The purpose of trying to do all of these is to overcome barriers to care. I'm going to talk a little bit about the barriers that families experience trying to get into perinatal mental health resources specifically, and that how support groups can actually meet that need. So the elements of the trauma-informed groups: structure and consistency. So again, after perhaps we've changed or adapted the model, it stays the same. So when parents come back each time, it's the same. So that's part of that, how do we accommodate or anticipate folks coming in with trauma, is we try and create a very consistent structure in which every time they come in, they know what to expect, and then they know how they can be in the group, and they can determine how much they want to share, when they want to share, if they want to share, that we create the structure that they get to choose if this is the space that they want to share in. So trustworthiness and transparency of the leadership. So again, even if it's a mental health provider, for instance, that's running the group, the facilitator takes a perspective of us and we, and we participate in the group. So to be a facilitator in a GPS model, you have to feel comfortable disclosing some information about yourself. And if you don't feel comfortable disclosing some information about yourself, it might not be the best model for you. So we don't ask parents in the groups to do anything that we're not willing to do. So in the beginning of the group, part of what every parent does is check in and kind of say how they're doing or what they're coming to group with. And the leaders do that as well. And we do that from a particular place. We're not kind of just sharing just to share. We're sharing, strategically. Some of the things that we're sharing about ourselves are things that we want the group participants to know they can talk about. So we're sort of modeling and using our check-in as an example of what they could talk about. But we're being authentic and we're being transparent. And we're showing them that, we also have ups and downs and all arounds in our life. And we're not there to do something to them or to, in quotes, treat them. But we're there to be with them. And to create a space where they can use that space in any way they want. Again, giving them all the opportunity and control of what they're going to share and how they're going to share it. So there's a lot of collaboration. There's a lot of mutuality. We often will ask each other. So like for instance, the group leader is not always the expert on perinatal mental health. So a lot of the topics that come up end up being a discussion, and the group leader might put provide some psycho ed or teach the group a little bit kind of organically as things come up. So for instance, if someone talks about anxiety, the group leader might say something like, yeah, we know that anxiety is actually really on the rise and actually could be even more common than postpartum depression. Something, small little nuggets that sort of help parents feel like what they're experiencing, that they're not the only one and that they're getting information around perinatal mental health. I talked a little bit about this already. You know, empowerment is one of those words that a lot of people use, and it can be unclear what it is or how we would actually work from an empowering place. But we like to think about it as giving voice and allowing choice. So like I said before, we're creating a space in which parents are choosing what it is that they want to say. And hopefully we're creating a place in which they feel like they can say the things that they need to say. And if parents aren't able to say the things that they need to say, then maybe we're not creating the space that we think that that we think that we are. And that we talk a lot about that in the training. One of the things that's really unique about the GPS model is that we really acknowledge right off the bat and almost in every single group that we are not parenting in a vacuum, right? That all around us, we're parenting within systems, right? We're parenting within cultural systems. You know, we're parenting within a historical trajectory in which, you know, we know that, for instance, people of color have been mistreated and subjected to racism, and now intergenerational trauma from that. We know that, especially around the time of becoming a parent for women, gender issues can come up and feel very strong. So if the parents that we're working with are partnered, talking about, you know, what are the different roles between the partners, can often be something that become really important. And so one of the things that we do in the GPS model is we talk about it. You know, we say we're not parenting in a vacuum. You know, we talk about how lack of having, for instance, you know, paid maternity or paternity leave impacts us emotionally. You know, an example is, you know, having to go back to work at 2 weeks or 4 weeks or 6 weeks and really not feeling ready and feeling quite anxious and depressed about having to leave our child, or feeling anxious about the care that our child will receive at the child care center that they're going to. That this is, you know, that's an example of where social policy and emotional health intersect. And so we're helping parents to see that they're part of a broader system that for sometimes it can feel invisible, and other times it can actually feel glaring, but we're bringing that right into the group. And we're not saying that those issues are outside of our experience as a parent, but actually really impact our experiences as a new parent, and actually could be impacting our emotional and mental health more than we think that it is. Another example might be how a person of color is treated throughout their pregnancy or at the hospital, perhaps even at a mental health agency, that experiences of interpersonal and structural racism are very, very impactful during the perinatal period, in part because women are in so many systems, you know, the healthcare system, the hospital system, if they are in, you know, any type of WIC or DSHS during their pregnancy or postpartum, and so they're having a lot more experiences, perhaps, where, you know, they're feeling judged or mistreated at the time when they're developing their experience of being a parent. And so those issues often are actually really, really relevant to talk about. And so we say, let's talk about it, which, as you can imagine, is a hard thing to do. And so the training really talks a lot about how to do that and how to do that authentically. The other thing that we do, again, sort of right up front, and we acknowledge it, is that we're all different and we all come from different backgrounds. So there's like the big cultural differences, but also, you know, each of our family has a cultural difference from each other's. And so, you know, right in the beginning of group, we often say something like, there's no one parenting style that is the right style. You know, that we acknowledge that everyone in this room today is coming from a different life circumstance, a different family structure, a different religion, a different culture, and that we're all coming to this differently, you know. And then we might say something like, and yet we also might find that we're all having some universal experiences that are common among new parents. So we're going to look for the universal experiences without erasing our individual differences of the places that we come from or the communities that we come from. And so we might say that, just like that, to the families, in which they are sort of hopefully given the message that, yeah, hopefully we're finding things that we're all experiencing that are universal. And also there might be things that are different. Someone might be, you know, wrestling with, you know, being a second generation immigrant and, you know, need to talk about acculturation and sort of the differences between their experience as a parent, and their parents' experience. And that might be something that they need to talk about in that group. And if we don't sort of acknowledge and allow people to bring that up and say that those issues are welcome here, they might not bring that up, even though that's what they need to be talking about. I talked a little bit about this, but this kind of overwhelming positive regard that we give to every person that walks in the room. You don't need to be perfect to be valued here. There's no prerequisite of needing to know everything and being a perfect parent in order to come to this group and share your experience. I'll talk a little bit about this later, but we hear lots of stories about parents going to mommy groups that really don't feel very safe, and where parents feel quite judged. And so we're working really hard in these groups to create a space for parents to feel safe, but also, we're really modeling that, so the facilitator really needs to be able to do that honestly and authentically with the parents. And what we're finding is sometimes the parents come and say, I'm using some of these ideas with all of my friends, and I'm noticing that, it doesn't matter if I'm breastfeeding and they're bottle feeding, or we're co-sleeping and they're, sleep training, that I can really understand where my friend is coming from or my sister is coming from, and it's actually deepened our relationship. So there's some cool stories that come out of it. So as you're probably gathering, this sort of empowerment model is really resiliency based, right? So GPS support groups hold out the inherent strength that individuals and groups with unique experiences have, even when they can't remember them for themselves, right? So it's really easy to think about all the things that are hard, right? And all the things that are bad. But what if we also remember and really authentically believe that each person and each individual actually has exactly what they need to take care of themselves and take care of their baby. And we're offering that to them every single time they come to the group. So every time they walk in, we're saying, look at what a great job you're doing with your kiddo. Look at how she or he looks up at you, when you're talking, and they'll be talking to the whole group and they'll look down at their kiddo and be like, oh yeah, she is responding to me. And so, by us holding that, that even if in those moments when they're feeling depressed or they're feeling traumatized, that we see their strength and we know that they'll find it again. It helps them to kind of be in their experience and know that they're going to get to the other side as well, and that we're with them until they get to that other side. So I want to kind of switch gears and talk a little bit about some of the outcomes that we've had from our groups. So this particular data set is from 2016 to 2017. We had about 130 parents run through our groups, and these are some of the outcomes that the moms reported after attending them. And I can tell you a little bit more. I'll run through this and I'll tell you a little bit more about the demographics of the groups. I actually don't think I have a slide on the demographics, but they were all women of color group, a Spanish-speaking group, two of those groups that I listed on the earlier slide, a group of parents, all Medicaid eligible in a sort of medium-sized town in Washington. So these are not sort of, white, middle class, well-resourced families, although there might be a few in there that meet that demographic. So anyways, 98% of the parents reported that the group helped them feel better. 94% reported that the group made a difference in their lives. 95% reported that they learned that self-care was important to their mental health. 62% reported that they had taken significant steps to improve their self-care, with another 25% reporting that they had taken some steps. This was interesting. So we asked in the outcomes about dosage, so how many groups that the parents had attended, and 79% of the parents that only attended one group. So of those people that, said, I think it was like maybe 30 or 40 of the parents had only attended one group, reported a decrease in depression or anxiety symptoms. And then 94% of the parents that attended 77 or more reported a decrease in symptoms. So we're seeing really great outcomes. One of the things that we had hoped for, obviously before doing this evaluation, was that the support groups would be a stepping stone. So there would be this idea of after attending a support group, parents would be more likely to engage in other healthcare services. And, you know, we know that families, new parents experience many, many barriers to accessing healthcare. So we know that most parents never access mental health care for a lot of reasons. We know women of color are less likely to access mental health care, and they're also less likely to receive a full course of treatment. So they're less likely to stay in care until their symptoms remit and then stop treatment at that time, that they stop before their symptoms go down. We know that women don't access mental health care due to misinformation on perinatal mental health. So, you know, the fear of, if I say that I have postpartum depression, you know, does that mean that I'm going to hurt my baby? Does that mean you think I'm going to hurt my baby, or that I'm danger to myself or my baby, which we know is not true. Fear of judgment about, you know, that you're not a good parent, or you don't like parenting if you are experiencing depression or anxiety. The stigma of mental health in general. Mental health is a word that many, many people just don't even use or feel comfortable using. And then a big one of the biggest barriers that we know, especially for women of color, is distrust of the mental health and child welfare system. So those systems have historically not been a safe place for communities of colors to go to access support. And perhaps those, the mental health system in particular I'm talking about, maybe isn't really set up for families of color, immigrant and refugee families. Another example, for those communities. So if you can't access mental health care in your native language, then, you know, there's a strong sense of this service wasn't really set up for me. If there's nobody that looks like you in the mental health system, if there's nobody that understands your cultural background or your religious background, it can feel like this service is really not set up for me. So one of the things that we had hoped for, that by attending groups, and, you know, one of the things you learn attending groups is, for instance, the prevalence of perinatal mood and anxiety disorders, PMADS for short, that by gaining trust in the support group leader, by sharing their story, by hearing stories from other women, that they might realize it's actually not that unusual to feel anxious or depressed after having a kiddo. And if the support group leader that I trust gave me a referral to someone that they trust, would they be more likely to access those services or those resources? So kind of with that hypothesis, we found that, you know, 94% of parents reported that they would be more likely to tell a healthcare provider about how they were feeling, and that 50% actually did access mental health care since attending group. So 50% of the parents that attended group actually access mental health care, which we know is far above the percentage of prevalence rates of actually accessing mental health care in the general population. So that's a pretty significant finding. The other thing that I just really wanted to point out about this group model is that we know that isolation is actually the #1 risk factor for postpartum depression. So PPD is short for postpartum depression. And the groups can be thought really as both prevention and perhaps a component of treatment. And we could actually be either reducing onset of perinatal depression or anxiety, or reducing severity by referring families into new parent support groups. So what we found was 95% of the parents who reported 95% of parents reported that the group helped them to feel that they were not the only ones who struggled after having a baby. And 100% of parents reported they felt the group provided a non-judgmental place to share their feelings. So that in a lot of ways, you know, we're doing what we were hoping that we were doing simply by creating a non-judgmental space for people to share their feelings. It allows these other things to happen as well. There's been a recent, I don't know if anyone heard about the United States Preventative Services Task Force recently, 2 years ago, had said we need to start screening and treating perinatal depression. And about 2 or 3 weeks ago came out with a new report that we need to be identifying the parents who are at risk for postpartum depression and anxiety and treat them. So these are, you know, what they are saying is identify the people who may not even be symptomatic, but could potentially become symptomatic, and we need to preventatively treat them, which is actually really, really huge. And some of the work that the support groups can actually do, which is really great. So here's just some quotes from moms. These are not lined up in terms of, you know, the first bullet point before group and this first bullet point after group are the same person. So it's not like a before and after for the same person, just some of the quotes we hear from moms before they attended group and then after. So before they attended group, some of the things that we hear from moms: I felt overwhelmed about being a stay-at-home mom. I felt like I wasn't a whole human being. I felt scared I might harm my child. I felt unqualified to be the mother my baby deserved. I thought of giving him up for adoption. I was questioning my current pregnancy. I felt hopeless. I felt like a hot mess. I wasn't sure what I was doing. And then some of the things that moms reported after the group: I feel spiritually fulfilled and clear head to get my life together. Dealing with marital and childhood hurt, so they're dealing with it now. I feel spiritually fulfilled, and oops, that's a repeat. I'm excited about my current pregnancy. Couldn't imagine life without them, kids. Great ideas come from group to help me be more productive, gave me more direction. I feel like everything is going to be okay, and I will make it. Oops, we move from powerlessness to empowerment. Oops, there's another part of this quote that's supposed to come up. Oh, there it is. By reclaiming the stories of our lives. So I told you I would share with you the upcoming training opportunities that I mentioned earlier. So there's a couple that are coming up that are part of our general training program that I told you about. So at the end of this month, there's actually a 3-day conference in Seattle that's all about the intersection of trauma during the childbirth, the childbearing period. And the theme of it this year is multidisciplinary approaches to prevention and healing. Check it out on the website, even if you're not going to come, because it's really, really interesting stuff. It's really looking at not just trauma like during childbirth, but parents that have experienced intergenerational trauma or trauma prior to becoming parents, how that shows up in the perinatal period, and then also impacts parenting in the postpartum period. It looks at birth trauma that happens like in the hospital, and it also looks at health disparities for women of color, which we know have the highest maternal mortality and morbidity rate. And so it's really looking at what is happening for women of color in terms of what they're coming into the birthing period with, the interactions they're having with healthcare providers during their hospital stay and during their birth and postpartum, and then also the implications for both the individual family, but also communities of color who are experiencing such high rates of trauma during childbirth. And then there's, many, many other aspects to the training. We also have a 10-month online clinical training and consultation program. This is specifically for mental health therapists. We offer these a couple of times a year, both in person. We have one in Seattle, one in Bellingham, and then we have this online group that we kind of are constantly rotating through. The online group is really great because it's just easy for people to get to, obviously, and is not place-based, and so it's open to anyone in Washington State. Those are self-funded, so there's no funding for providers to attend those. I had mentioned the 2-day training that we're doing in Spokane. This is funded by DCYF, so it's a 2-day training in best practices of perinatal mental health. At the end of the 2 days, folks will have a really good sense of what is the whole spectrum of perinatal mental health, how do you screen for it. You won't at the end of those 2 days know how to treat perinatal mental health, but you'll know what are the components of care. You will know based on different scopes of practice and different professional credentials, sort of what are the best sort of referral practices, what are the like self-care practices that we can talk about with parents, and then we'll also be talking about things like medication during the perinatal period, relationships, impact on children. You can see that on the website. That is no cost to the providers, so that's completely funded by DCYF. And then we'll also be hosting a 2-day group peer support facilitator training in Yakima, Washington. We have not nailed down the dates for that quite yet, but it will be probably in May or June. And it will be open to east side of the state providers to attend that training at no charge to them. Again, it is funded by DCYF. And sorry, my computer, there it is. So thank you so much for attending today. This video will be put onto the Perinatal Support Washington website, and so, you know, if you want to watch it again or if you want to share it with a colleague, feel free to. It'll be on the, we have a section that's for providers and on education for providers, so it'll be on the website there. There is just a few minutes, and there is a chat function, so if you did have a question, you can actually just type it into the chat box, and I'd be happy to answer it. And I'll just give folks a couple of minutes if anyone wants to type in a question. Okay, well, I don't see anybody typing. So I didn't put my email on this last slide. I'm so sorry. My email was on the first slide, but oh, there is a question. How do we apply for the group facilitator training? If you are in one of the seven identified communities that we talked about, then we are asking the community to talk about who should be facilitators, what organizations should host support groups at the task force meetings. So you go ahead and email me. So my email is, oh, I can actually type my email for you all to see. So my email is mia.edidin@perinatalsupport.org. If you are on the East Coast of the state, you are eligible to attend that Yakima training. And again, feel free to email me and I can tell you more about it. Okay, well, I don't see, will there be a separate facilitator training for community healthcare workers in one of the 7 areas? Yes, if you are in one of the 7 funded communities, you will have your own facilitator training and I will connect with you, or you're welcome to email me. So we're scheduling those now, and depending on which community you're from, there'll be different trainings that you can attend. So it looks like that's from First Step, so from Clallam. So feel free to just email me. We're hoping to schedule that training to be in Olympia, and I was just looking at that today in May or June. So we have not settled the date quite yet, but we're doing that very shortly. Okay, well, I want to thank everyone so much for being here today. Like I said, this video will be available on the PS Washington website, so feel free to let other people know about it so that they can access it. And again, if you have any other questions, just feel free to email me. Thank you so much, everybody. Have a wonderful day.